A fracture is a broken or cracked bone. A compression fracture happens when a bone is crushed, either suddenly or as a result of a long, slow degeneration. When this happens in a vertebra, the spine can shift position, causing muscle pain, nerve pain, and damage to the discs. If the compression fractures are severe, the spine can take on a hunched or rounded appearance, a condition known as kyphosis. Most compression fractures of the vertebrae are caused by osteoporosis, a disease that makes bones weak and brittle. This weakening can be so gradual it isn't noticed, and it can result in severe damage from ordinary activity. Compression fractures and osteoporosis are more common with advanced age, among women, and among individuals who have used long-term corticosteroid medications such as prednisone. The pain from a compression fracture is made worse when you pick up something heavy, though the pain often fades after a few days or weeks. Compression fractures may heal imperfectly without proper care, resulting in a permanent curve or misalignment of the spine. This can put stress on muscles and tendons in the back and sometimes results in chronic, dull aches or pains. Conventional X-rays can help a physician determine if back pain is due to a problem with bone. X-rays are an invisible form of energy that can pass through soft materials but not solid ones. Thus, X-rays can show the vertebrae of the spine well, but cannot show much about the muscles, tendons, ligaments, and intervertebral discs that are often involved in a back problem. X-rays are painless, though you will be asked to remain still while an image is taken, and this may or may not be uncomfortable. X-ray images are developed within minutes, so your doctor will be able to explain the results shortly after they are taken. The radiation levels used in today's X-ray machines are extremely safe. However, women who are pregnant should consult their physician prior to any X-ray examinations. Posterior is the medical word for back. Posterior fusion means surgery to fuse two or more vertebrae through an incision made in the back of the body. The length and location of the incision depends on the number and position of vertebrae your doctor will be fusing. After the vertebrae are exposed, a discectomy is performed to relieve pressure on the nerves. The surgeon will check for other nerve compression. To maintain the disc space height after discectomy, a wedge of bone taken from your pelvic crest or donor bone is shaped and placed into the disc space. The surgeon may also place instrumentation, such as a fusion cage filled with bone, into the disc space. The wedges or cages maintain the height of the space and are held in place by normal compression of the spine. Sometimes plates or rods are screwed into the vertebrae for further stabilization. Your incision will be closed with dissolving stitches placed under the skin, or with surgical staples that are usually removed before or soon after discharge from the hospital. Postoperative blood drainage is expected for a day or two. A drain is placed under your back muscles to keep the bloody drainage from collecting beneath the incision. A bulky dressing